weather events, environmental degradation, and socioeconomic inequalities exacerbate the risk of infectious disease outbreaks. However, there are significant challenges in obtaining science-based evidence to understand and predict the impacts of extreme events and landscape changes on disease risk, leaving communities in climate change hotspots vulnerable to increasing health threats. The HARMONIZE project brings together an interdisciplinary community of practitioners, community-based organizations, local governments, climate scientists, epidemiologists, software engineers, and data scientists to address these challenges. The vision for HARMONIZE is to build user-friendly and reproducible toolkits that can serve decision makers operating in climate change hotspots in Latin America and the Caribbean, including cities, small islands, highlands, and the Amazon rainforest, and allow them to produce data sets that they can analyze to track changes in infectious disease risk due to environmental and climatic change. The HARMONIZE Toolkit is an open-source, reproducible suite of digital tools designed to collect, harmonize, and integrate diverse data sources, including ground-based sensors, drone imagery, satellite observations, climate reanalyses and forecasts, as well as socioeconomic surveys and health surveillance systems. In HARMONIZE, we organize engagement workshops in Brazil, Peru, Colombia, and the Dominican Republic, where we invite experts from meteorological services, health ministries, environment agencies, and international partners to support evidence-based decision-making and understand better the impacts of climate change on disease risk in those regions. This gives us the opportunity to develop engagement activities, to get to know the end users of our toolkits, to exchange ideas and to hear their expectations about the HARMONIZE project.
So in HARMONIZE, we want to pave the way to construct a common language between all the disciplines that work on the climate science and with the climate crisis. We believe that the common language will be data, so we are trying to get harmonized data so they can understand what is going on from multiple lenses.
Tenemos muchísimos datos y poca capacidad de analizarlos, así que en el HARMONIZE esperamos obtener algunas posibilidades de crear y analizar grandes bancos de datos con unas técnicas más modernas.
La idea del proyecto es que los datos sean homogenizados, tanto los de salud como los meteorológicos.
Because the idea is to translate that data that they are harmonizing to try to train not only the researchers, not only the academics, but also the decision-making process.
We hope that HARMONIZE will be able to provide us a more continuous and reliable climate record that we could use to feed our predictive models.
In each of the HARMONIZE hotspots, we have a strong connection with the public health and environmental agencies who are helping us identify the hotspots for disease cases, vectors, and helping us choose the areas where we can conduct detailed mapping using drones to help the community better understand the zones most at risk for infectious disease transmission.
Yo considero que este proyecto nos puede servir, entre otras cosas, para poder establecer si el cambio climático nos puede cambiar la distribución geográfica de los vectores.
E o que é que a gente observa? Muitas áreas desmatadas, né? Muitas famílias hoje morando em torno dessas áreas desmatadas também. E essas famílias, elas são muito propensas a desenvolver doenças, principalmente por vetores. Doenças que são ali da oportunidade daquele vetor de se alimentar. Um vetor da malária, um vetor da dengue, um vetor da doença de Chagas.
Creo que son de las grandes cosas. Dos pueden estar muy articuladas. Desarrollo, apropiación tecnológica que nos permita fortalecer los sistemas de información en salud para departamentos, regiones como el Tolima, en el marco de la atención de ciertas patologías, las arbovirales, las respiratorias, las crónicas no transmisibles. Creo que podría ser una muy buena iniciativa.
hotspot in the Amazon region was chosen because it is a climate-sensitive area, and there are problems with Chagas and malaria and other diseases that are affected by climate change.
So we're joined today by representatives from the Ministry of Health, from the vector control teams, from the Environment Agency, and by team members who are working in the field to collect data and ensure that the HARMONIZE tools were going to serve the needs of the community.
The HARMONIZE project, it's very important to engage with the local communities because we're focusing on specific territories where people can perceive the changes in climate change and suffer the infectious diseases that we're trying to address through these technologies. Community engagement is also very important when you're using drones to collect data because in ethical terms they are being filmed from the above.
Hoje nós fizemos uma atividade de conscientização das crianças com relação ao meio ambiente, às mudanças climáticas e como isso tem impactado as doenças transmitidas por vetores naquela região.
In this activity, we try to simulate with them how the dengue transmission happens and also how they can avoid the infection using protection.
In the school, we conducted some activities and some games to help the children understand how dengue is spread and the kind of measures that families can take to protect themselves from dengue. The teams show everyone the drone images that were taken in the previous campaign to help identify the hotspots for disease transmission. So areas close to garbage dumps, areas with lots of dogs, or areas that are known to have lots of mosquitoes.
The idea is to understand how the people interact with their environment in a really granular way. So we know where the households are distributed, we know how close are they to the rivers or to the forest, and in these places we want to understand what is the interaction with some infectious diseases such as malaria, dengue, leptospirosis, or other climate-sensitive diseases.
So we selected the 3 study sites not only based on altitude, but we had places with different vegetation coverage and ecosystem coverage, and also that had different land uses and human interaction.
These data sets are going to be useful because usually all the satellite products are like at really coarse scales. So drones are going to help us downscale and have finer resolution and get those local features that potentially are affecting human health.
Então, esse mapeamento, os mapas que são produzidos, depois eles são devolvidos para a Secretaria de Saúde e para a comunidade local como uma devolutiva do projeto, para que eles possam utilizar esse produto, esses mapas, para ter um maior detalhamento do território e entender mudanças que aconteceram ao longo dos anos.
E buscamos nesses lugares alguns elementos de paisagem relacionados com os vetores, como, por exemplo, locais de efluentes domésticos, locais onde existe a presença de lixo, ou outros locais onde tem água parada, áreas alagáveis, entre outras, que são favoráveis, né, à ocorrência de algumas espécies, como os barbeiros ou até mesmo alguns mosquitos.
There are teams using the drone to map the region, and also teams applying questionnaires to get information from the community. And there are entomologists collecting vectors from potential breeding sites, and everything in collaboration with the local health professional.
Cada vetor tem seu nicho, né? E esse nicho a gente detecta em função das imagens que é feita pelo drone.
Se sabe por laboratorio que el efecto de la temperatura en algunos vectores los hace desplazarse, algunos cambian su distribución altitudinal, entonces es posible que debido a estos cambios ambientales haya una migración de los vectores y los encontremos en lugares donde antes no estaban. Entonces eso nos va a poder cambiar el mapa de distribución de enfermedades.
We install weather stations directly in the areas we're studying because having high-quality local weather data to describe rainfall, temperature, humidity and wind speed is essential for accurately understanding the environmental drivers of disease transmission.
Um projeto HARMONIZE, a gente está instalando 2 estações, uma em Cametá e outra em Mocajuba. São áreas que não têm estação meteorológica dentro do país, e uma delas a gente tem um sensor que mede o nível do rio, que vai ajudar muito a população a se locomover e entender a questão de cheias e secas.
Importantísimo el aporte que hacen ustedes a través de la instalación de esta estación meteorológica. Entonces, de pronto uno en un sueño piensa que vale la pena tratar de comunicar esas ideas y comprometer a la gente en recuperar lo que es importantísimo para nosotros, la vida, el medio ambiente, el mundo, la naturaleza.
Aquí en el departamento del Tolima, los principales criaderos de la Aedes aegypti son las albercas, se conocen como tanques bajos, y es donde la gente deposita su agua para lavar la ropa, de ahí también la sacan para cocinar. Aquí en el Tolima tenemos un inconveniente en algunos municipios, que es el suministro de agua constante.
O açaí é um produto bastante importante, né, para a população ribeirinha da Amazônia e para o Baixo Tocantins. Porém, é um produto que, se não for manipulado ou processado adequadamente, ele pode levar à transmissão de doenças.
The fruit is often harvested from palm trees in forested areas where the triatomine bugs, which are also known as kissing bugs, are common. The acai pulp can become contaminated with the parasite that causes Chagas disease. When consumed raw or unpasteurized, contaminated acai can lead to outbreaks of the disease in humans. I'm based at the Barcelona Supercomputing Centre, where I lead the Global Health Resilience Group. We work together with climate scientists, software engineers and knowledge integration experts to develop cutting-edge modelling and digital innovations at the intersection of climate and health to enhance resilience to climate-sensitive health challenges globally and locally. We make use of Mare Nostrum 5, which is one of the world's most powerful supercomputers. It can make 314 billion calculations per second, which is like the combined power of hundreds of thousands of laptops working together at once. With this sort of computing power, the HARMONIZE team is able to collate and process large volumes of climate, environment and socioeconomic data, along with health data, and combine this with new longitudinal ground truth data collected in our study sites. We use this data to calibrate and downscale coarser resolution Earth observation, climate reanalysis and forecast data to ensure the harmonized data sets can better represent the climatic and environmental conditions in the places where disease transmission is happening among communities.
Yo creo que el HARMONIZE puede ayudar en el debate de clima y salud. Ahora la población, la sociedade civil está muy movilizada por las cuestiones de clima y salud.
Eu acredito que as novas tecnologias elas vão nos ajudar, nos ajudando a visualizar, na verdade, o problema em si.
O projeto HARMONIZE, ele traz para a comunidade um grande benefício, que é a identificação, né, desses locais de grande ocorrência de doenças.
Currently, all the institutions working in climate spend a lot of time dealing with data and with data problems. So the idea is that HARMONIZE really reduce the burden on those institutions so we can get better and more timely decisions for those emergencies.
The HARMONIZE project has this very nice feature, which is bring together health people that works at these real places to get a bit of reality into the climate, and environmental scientists working with remote sensors or observation.
Nos facilitaría quizá esto, ver cómo podemos hacer para hacer informes sobre alerta temprana de cómo un fenómeno puede afectar la salud.
So now with this project, I think would be helpful because we are going to have the same format. We're going to have an harmonized data so we can have an early response and in this case, decrease the morbidity and the mortality, which is the most important in terms of health.
Ele traz essa possibilidade da gente poder descentralizar a ação de vigilância em saúde para atores específicos nos estados, nos municípios, que vão poder ter mais oportunidade de trabalho, ser mais oportuna a ação da vigilância com a utilização dessa ferramenta. Acho que é um grande avanço.
I think the uniqueness of HARMONIZE is the emphasis on data. How can we get data from different groups, research and policy, environmental and health, and then if there's a toolkit that can be applicable in different contexts with local data, it might be very useful and facilitate the decision-making processes.
HARMONIZE project takes our project into a whole new level of data, helping us deal with the volumes of data that we possibly could not within our project.
Proyectos que nos permitan apropiarlos, tomar decisiones de manera clara, oportuna, directa, rápida, de intervención para nuestras poblaciones. Creo que sí deben ser como ese tipo de proyectos son los que necesitan las regiones.
Vector-borne diseases don't just impact health. They strain economies through lost productivity and very high healthcare costs. They also deepen inequalities by impacting communities most at risk. By creating multi-source, temporally and spatially harmonized datasets, the HARMONIZE Toolkit empowers researchers, public health professionals and policymakers to uncover actionable insights, strengthen health systems and build climate resilience.
you.